Asthma is a chronic respiratory condition. Look at this picture, shows that bronchus obstructions, chest X-ray findings. Look at this. CT images and MRI findings. Look at this detail going on. Introduction. Asthma is a chronic inflammatory disorder of the airway characterized by variable airflow obstruction, bronchial hyperresponsiveness, and an underlying inflammatory response. It affects millions of people worldwide and can significantly impact the quality of life. Asthma can range from mild to severe, and if not managed properly, can lead to life-threatening exacerbations. A definition. Asthma is a chronic respiratory condition that causes episodes of wheezing, breathlessness, chest tightness, and coughing, particularly at night or early in the morning. It is often triggered by allergens, respiratory infections, physical exertion, or environmental pollutions. Etymology. The word asthma comes from the ancient Greek asthma, meaning panting or short drawn breath, derived from the verb asthmanian, meaning to pant or breathe heavily. It was later adopted into Latin as asthma and entered English through Old French. Types 1. Allergic asthma, triggered by allergens such as pollen, dust mites, mold, pet dander. 2. Non-allergic asthma, triggered by infections, stress, exercise, cold air, strong odors. 3. Exercise induced asthma. Symptoms occur during or after physical activity. 4. Occupational asthma, caused by exposure to workplace irritants such as chemicals, dust, or fumes. 5. Nocturnal asthma, worsens at night due to factors like allergens, body positions, or temperature changes. 6. Cough variant asthma, characterized primarily by chronic cough without classic wheezing or breathlessness. Causes: 1. Genetic predisposition. 2. Environmental allergens. Pollen, mold, pet dander. 3. Respiratory infections. 4. Air pollution. 5. Tobacco smoke exposure. C. Cold or dry air. 7. Strong emotions and stress. 8. Certain medications. Example: beta blockers, aspirin. Risk factors: 1. Family history of asthma or allergies. 2. Exposure to allergens and irritants. 3. Smoking or second-hand smoke exposure. 4. Obesity. 5. Respiratory infections in childhood. 6. Occupational exposure to chemicals or fumes. Complications: 1. Frequent hospitalization due to severe attacks. 2. Reduced lung function over time. 3. Side effects: long-term medication use. 4. Increased risk of respiratory infections. 5. Anxiety and depression due to disease burden. Pathophysiology: asthma pathophysiology involves a complex interplay of airway inflammation, bronchial hyperresponsiveness, and airflow obstruction. Here is a step-by-step breakdown. 1. Trigger exposure. Allergens, example: pollen, dust, mites, irritants. Example: smoke, pollution, infections, exercise, or cold air. Can initiate an asthmatic response. 2. Immune system activation. Dendritic cells presents the allergen to T helper 2 Th2 cells, leading to the response of inflammatory cytokines. 3. Inflammatory cell recruitment. These cytokines attract eosinophils, mast cells, and other inflammatory cells to the airways, causing further immune activation. 4. Mast cell degranulation. Mast cells release histamine, leukotrienes, and prostaglandins, leading to early phase bronchoconstriction and increased vascular permeability. 5. Bronchial hyperresponsiveness. The airways become overly sensitive to triggers, leading to exaggerated narrowing in response to minor stimuli. 6. Airway edema and mucus production. Chronic inflammation causes swelling of the airways, walls, and excessive mucus secretion, further obstructing airway and airflow. 7. Airway remodeling. Chronic changes. Repeated inflammation leads to thickening of the airway walls, fibrosis, smooth muscle, hypertrophy, and permanent narrowing, reducing lung function over time. 8. Airflow obstruction. The combination of bronchoconstriction, mucus plugging, and airway swelling leads to difficulty in exhaling, causing wheezing, shortness of breath, and chest tightness. 9. Resolution or progression. With treatment, example bronchodilators, corticosteroids, inflammation can subside, restoring normal airflow. But without treatment, persistent inflammation can lead to worsening symptoms and chronic airway remodeling. Signs and symptoms: 1. Shortness of breath. 2. Wheezing. 3. Chest tightness. 4. Chronic cough, especially at night or early morning. 5. Increased mucus production. 6. Fatigue due to disrupted sleep patterns. A diagnosis: 1. Medical history and physical examination. 2. Pulmonary function test. Spirometry to measure airflow limitation. 3. Peak expiratory flow measurement determines airway obstruction. 4. Methacholine challenge test assess airway hyper responsiveness. 5. Allergy testing identifies potential allergies. 6. Chest X-ray or CT scan rule out other conditions. Nursing diagnosis: 1. Ineffective airway clearance related to increased mucus production. 2. Impaired gas exchange related to airway obstruction. 3. Ineffective breathing pattern related to bronchospasms. 4. Anxiety related to difficulty breathing. 5. Deficient knowledge regarding asthma management and triggers. Medical management: 1. Bronchodilators, example albuterol for immediate relief. 2. Corticosteroids, example prednisone to reduce inflammation. 3. Leukotriene modifiers to prevent symptoms. 4. Long-acting beta agonists. Example, salmeterol for maintenance. 5. Immunotherapy for allergy-induced asthma. 6. Oxygen therapy in severe cases. Nursing management. 1. Monitor respiratory status and oxygen levels. 2. Educate patients on trigger avoidance. 3. Teach correct inhaler and nebulizer use. 4. Prompt adherence to medication regimen. 5. Encourage breathing exercises. 6. Provide psychological support. Treatment options. 1. Quick relief medications, short acting bronchodilators. Example, albuterol. 2. Long term control medications. Inhaled corticosteroids, LABAs, leukotriene inhibitors. 3. Biological therapies, monoclonal antibodies for severe cases. 4. Lifestyle modifications, avoidance of triggers, dietary changes, weight management. 5. Alternative therapies, yoga, acupuncture, herbal medicines. Psychosocial medicine. 1. Patient education, teaching self-management strategies. 2. Stress management techniques, relaxation exercises, meditation. 3. Support groups, peer support to reduce anxiety. 4. Cognitive behavioral therapy, CBT, helps manage asthma related anxiety. 5. Family counseling, involves family members in disease management. Prevention. 1. Avoid allergens and environmental triggers. 2. Maintain good indoor air quality. 3. Get vaccinated for influenza and pneumonia. 4. Practice good hand hygiene to prevent infections. 5. Follow a personalized asthma action plan. In conclusion, asthma is a chronic but manageable condition with proper medical care, lifestyle modifications, and adherence to prescribed treatments. Early diagnosis, patient education, and preventive strategies play a crucial role in controlling symptoms and reducing exacerbations, ultimately improving the patient's quality of life. Thank you. Have a nice day.